Hello, everyone, and welcome to a fresh episode of ATP Hour. Wherever you're watching me from, some of you are watching on ATP Facebook group and pages or the Fresh Waves Facebook page. I want to welcome you, especially to this episode. I'm Gbemisola Boyede. I'm a pediatrician, and I really thank you so much for joining me today. And for those of you who are listening to us on Fresh Waves Radio, and those who are listening also on the Ask Dr. Gbemi podcast, I thank you so much for joining us and for listening. This is Ask the Pediatrician Hour. It's a program where we share and discuss on topics that have to do with the health of our children. And so today we've come again to discuss another very important topic by popular demand. A lot of parents ask these questions, and that is why we're going to be talking today about bedwetting. However, before we go into the topic, I just want to let you know that this program is brought to you by Ask the Pediatricians Foundation. Ask the Pediatricians Foundation is committed to the health and welfare of children globally, and we do this through our health education and information programs online on our Facebook groups, our Instagram and website, and also through such programs like the one you are watching or listening to right now. We also go on community medical outreaches to villages and communities where there's limited access to the pediatrician. So our goal is to see that no child dies from preventable causes of death. And we are here to just provide this health education, and we believe that ignorance is one of the things that is responsible for most of the deaths of our children. And if parents have the right information, they are empowered to better take care of their children. So thank you so much for joining us today. So today's topic is a very popular topic. It's the topic of bedwetting. I mean, this is something most parents are usually worried about, and they always want, like, what is the solution quickly. So today we'll talk about bedwetting. We'll talk about simple tips on how to handle it, and also how to get the right treatment for it. Yes, some of you may not know, but bedwetting is actually a medical condition that is treatable. Okay, and so that's what we're going to be talking about today. Okay, so let's just start by talking about what is bedwetting itself. So when we refer to bedwetting, just like the name said or implies, it is a child who is wetting the bed, usually at night, beyond the age when we expect them to have been able to uh, keep dry throughout the night. Okay, now that's very important. Sometimes we call it nocturnal enuresis, but I want to use the term that most parents are familiar with, and which is bedwetting. So a child sleeps, and through the night, involuntarily they pass urine, and we refer to that as bedwetting. Of course, sometimes it can also occur during the day when the child is sleeping during the day, or when the child is actually awake during the day. So we can talk about daytime wetting and nighttime wetting, but majority of the time parents we're talking about more of the nighttime wetting. Okay, and that's what we mean by bedwetting. Now, one thing we need to know is that there's a particular age that we begin to actually see children at bedwetting, because we see a lot of parents, even the 2-year-old, they're already worried about bedwetting. Actually, we don't consider that bedwetting, because usually, though from age of 2, some children can be dry at night, but we usually don't intervene or consider it, define it as bedwetting until the children are about 5 years old. So usually it is after the age of 5 that we can now categorically say a child is bedwetting. So if your child is 4 years old or 3 years old and they are still wetting the bed at night, we don't count that as bedwetting. We still believe that they are in that age, though majority of children would have achieved, dry nights maybe by the age of 2 or 3, but we know that it takes up to the age of 5 before almost 90 or majority of children will be able to keep dry throughout the night. So if after the age of 5, a child is still wetting the bed, then that is when we start talking about bedwetting. Now, why do children bedwet? Actually, after the age of 5, why the children bedwetting? There are actually things that could explain this, and we look at it in three areas. Number one, where there are some organs we need to consider when we're talking about bedwetting. We're talking about the bladder. So the bladder is like the storehouse of urine. That is what store the urine. So when a child has make urine, it's not every time they make urine they pass it immediately. The urine is stored in the bladder until it gets to a certain level that the bladder cannot hold it anymore. Then the child will feel the urge and then they will go and pass urine. Okay, so we talk about the bladder. We also talk about the brain. All right, so there is some hormone in the brain that controls the production of urine. We call it antidiuretic hormone. And if the brain, for one reason or the other, is not producing enough of that hormone, then it means that the child will make so much urine, and then they will always want to pass urine, especially at night. So the bladder will be so full, and of course, they will pass urine, and that is why some children bedwet. So another thing that is also involved is the what we call the sleep. Like when children are sleeping, some children are so deep asleep that they don't tend to wake up. So they don't recognize the fact that it is time for them to go and use the toilet to pass urine. So they are what we call deep sleepers, and such children also may struggle with bedwetting. So usually when children bedwet, those are the major reasons. However, there are other bedwetting that we call secondary bedwetting. For example, you see that some children have already they already dry, okay, and then all of a sudden they start to wet the bed again. So we call that secondary enuresis. In other words, this child has been dry before, maybe more than 6 months. Then all of a sudden they start to bedwet again. So when that happens, we are talking about there must be something that is making this child to do that. There are medical conditions or certain situations that would have caused that child. So usually if a child has been dry before and they now start to bedwet again, we start looking for those causes. We look for causes like urinary tract infection. If they have infection, it may make them to start bedwetting more because they have this feeling of wanting to go and pass urine, and sometimes when they cannot hold it quickly, they can wet the bed. Also, things like diabetes, like children who have diabetes, for example, they make a lot of urine. As a result of that, some of them can also bedwet. Also, children who have kidney problems like sickle cell disease that can affect the kidneys, or even kidney failure and all those other kidney problems, they can also have that. So when children are bedwetting, we also have to be sure that they don't have any medical issues that can explain the bedwetting. And for the medical issues, they are very straightforward. So, for example, when the doctor sees the children, we look out for things like we can send their urine for urine tests to know whether there's any infection. We can check the urine for sugar to know whether there's diabetes, and those are we can easily quickly rule those ones out and we can treat it. But the bedwetting I'm talking about today is the one where there's no medical problems. And another thing when we talk about bedwetting, we also have to remember constipation. When children are constipated, they also tend to bedwet. So constipation is when there's so much stool that is hard, because the bladder that stores the urine is directly opposite the rectum that stores the stools or the feces. So if there's anything in the rectum area, it will press on the bladder. If there's so much stool, both of them are elastic kind of spaces or organs, so they can expand. So if there's so much stool in the rectum, it will press on the bladder compress the bladder, leaving only small space for urine to stay in the bladder. And that means that that child will always, any little urine that is in the bladder, the child will always want to go and pass it if the child is awake. But when they are sleeping, there's not enough space for the urine, and then urine can easily overflow and the child can bedwet. So we will talk a lot more about constipation when we're talking about bedwetting, because before we can even talk about handling bedwetting, we have to deal with constipation. We have to make sure that child is not constipated. We have to treat any child that is constipated, get rid of all the stools so that there will be no space for the bladder, the urine storehouse, to expand. And so that is another thing. So if a child is constipated, if a child has infection, urinary tract infection, diabetes, or other urinary tract problems, they can have they can also bedwet, but there will be other signs in such children. Most of the time, those children may also have what we call the daytime symptoms. They will also have this feeling of always wanting to go to urinate frequently. They always have the urge to go and urinate so quickly and all that. So there will be other signs that will tell us. Or if some children have some neurological problem as well, we will see those signs, when we examine them. But most other children, they are well, they are fine, they don't have any health problems, but they bedwet only or mostly at night. Then we talk about the primary enuresis, or the nighttime wetting that we're really considering today. And so when children are bedwetting, and it's always a problem to the parents. Number one, is psychological, even for the child. Especially for those of them who have to go to boarding schools. It can be a stigma. It can make them to be embarrassed, and like going for sleepover is something that the children will begin to dread. And sometimes some of our parents, when a child is bedwetting, we kind of shame them and all that, so they are so scared. And so it is something, and parents always look at it as if maybe that child is not is not well trained, or the child is just doing it by himself. But I really want you to understand that bedwetting is actually a medical condition, and it can be treated. So it's not like a child's fault. Okay, it's one of the things we really need to understand, that it is not a child's fault that they are bedwetting. I've already told us what is that responsible. Sometimes it's because the children is making so much urine at night due to that low level of the hormone, the antidiuretic hormone. Or sometimes the child is sleeping too deeply and they cannot easily wake up. Or sometimes it is the bladder itself is not sending them enough, message, or it's not expanding well to accommodate the urine. So any little urine, it just come out. So those are the major reason why some children bedwet. All right. So now, what do we do to if a child is bedwetting? How do we help the child? Before people just say, "Oh, don't worry, the child will outgrow it. Just leave them alone." Nowadays, we don't want to do that. I've already told us, once a child is 5, if they are still bedwetting, then we need to seek help for them. Don't just leave it to chance that, okay, the child will outgrow it. Nowadays, we don't want to wait. We want to do something about it, because there are some simple tips that we can do. And if we do those simple tips, and the child will be able to get over the bedwetting, number one. So after we do those simple tips and the child does not get over the bedwetting, then the child needs to see a pediatrician or doctors who knows how to treat a child with bedwetting, and that will help the child, to be able to get over the bedwetting and all the stigma and all the psychological distress that comes with it. Now, so when we talk about how to help our children to overcome bedwetting, we need to promote what we call good bladder and bowel habits. That is the first thing we need to do. The first thing is not treat medication and all that. It's about promoting good bowel and bladder habits. And I'm going to tell us at least about 5 or 6 tips to promote the good bowel and bladder habits for our children. Number one is that we need to make sure that the children, they go and poo regularly. They need to poo. They shouldn't be constipated. And I've already explained to us why that is important, because the poo area of the rectum is just directly behind the bladder, the store of the urine. So if there's too much poo in the uh, in the rectum, it presses on the urine in the bladder, and it makes the bladder area to be smaller, and it will not be able to hold much urine. So you see the child that's going to wee now, the child feel like going to wee again. But when you remember, if they are sleeping, they don't tend to wake up that often. So that's why they tend to bedwet. So before we can even talk about urine or bedwetting control, we have to take care of constipation, and constipation has to be treated. So a lot of people believe that if a child is constipated, just give them water, give them orange and all that. Now that is to prevent constipation. To prevent constipation is for them to take water, eat a lot of fruits, veggies, things that are rich in fiber and all that. But once a child is constipated, and when we say constipation, means the child is not passing stool frequently, and when they want to pass, it is so hard. So a child who is not passing urine often, maybe once in 3 days or 4 days, and when they are passing, it's so hard. And I think there's a time I showed some of us the stool, the way to the chart for stool. So if the stool is so hard, like it's coming in like pellets, or like a corn, like a comb of a corn or something like that, then that is constipation. And you see the child is straining and they have so much pain. Once the child is constipated, we actually have to give them laxative. We have to give them medications that make it easier for them to pass the stool. So you have to say doctor, or you can go to the pharmacy and they can give you a laxative. So things like lactulose, things like Movicol, even liquid paraffin, they are all of them. They are things that the child has to take so that they can pass out the stool. We have to treat that constipation. And sometimes for some children, you have to take that medication for a couple of weeks or even months to make sure they will get the constipation under control. Because as long as the child is constipated, we cannot even begin to deal with the urine. We cannot even begin to undo the bedwetting part. So that is the first thing we need to do. So if your child is bedwetting, the first thing you need to do is to make sure that you get them, if they are constipated, you get them treated for constipation. That is the first thing we need to do. You can get your doctor or your pharmacist to give you those laxatives and get the constipation out of the picture. And that is number one. We want the children to be passing stool at least maybe every 4 times a week. They don't have to pass it every day, that's not necessary, but at least 4 times a week. And it should not be hard. It should be like what we call stage 4 stool, like sausage, like soft, and that kind of stool level. That's what we want. So that is the first thing when it comes to maintaining a healthy bowel habits. Now, the second one is if a child has other causes of illness, some children, they don't know how to handle their bladder very well. We need to help them with that. So if they have other problem like infections, like diabetes and all that, it has to be treated. And that one is to get done by the doctors anyway. So usually that's why you need to see the doctor. So if a child is having symptoms like they're always rushing to go wee, that's what we call urgency. It's as if they don't rush, sometimes it's as if the urine will just come out before they get to the toilet. So that is urgency, and then they are always going more than 7 times in a day. That is what we call frequency. Every 30 minutes, every 1 hour, they are going to the toilet. That is frequency. But when they are rushing as if the thing is going to come out now, that is urgency. If the child is having all those symptoms in the daytime, that's you need to see a doctor for that, so that the child can be treated, can be investigated and treated as well. Also, we need to let children remember to wee once they feel the urge, because some of them these days they're watching their cartoon or doing some other things they like, and they feel the urge, but they don't want to get up. They just want to keep watching, and then they leave it to the last minute, and then they're rushing, and that's not a good thing. We need to encourage them. Once you feel it, you just need to go to the toilet. Now, the next thing when it comes to children, when we talk about good bowel and bladder habits, is that they need to drink a lot of water, especially during the day. I know this may sound contradictory, because most parents, when their children are bedwetting, then what they do is to actually reduce the water. They say, don't drink much water so that you will not go and wee with the bed. Actually, the opposite is what we should be doing. We need to actually make them drink a lot of water, but they need to drink it during the day, not in the night time. So the children need to drink a lot of water. And when we say a lot of water, we want them to drink at least like um 4 to 6 cups, of water. 6 to 8, actually, 6 to 8 glasses. A glass cup like the 250 mils glass cup. So they need to drink 6 to 8. So we're talking about 3 liters or 4 liters of water, and they should drink all this water at most before 7 p.m. So we want them to drink it loads during the day and then less at night. The good thing about drinking lots of water, number one, they will not have constipation. Remember, I just talked about how constipation is very important when we talk about bowel and bladder habits, because if they're constipated, they're going to bed white as well. So drink a lot of water. We help them not to get constipated. Two, it helps them to sense their bladder filling up, and then they begin to understand how to go to toilet. So they feel the bladder is full, they can feel it, and then they can go to the bathroom. So it helps them to understand how the bladder work, and the senses that comes with the full bladder and all that. So they really need to drink lots of water during the day. And sometimes children don't remember to drink water. Sometimes you just have to remind them. So for example, when they're going to school, make sure you fill their bottle with water and let them, you have to finish that, before you come back. And then when they come back, you may sometimes, these days we have all these apps that reminds children to drink water. So there's a time I used to set up that app for myself and for my son. Then so you just remind them, the app will just say it's time to drink water. Then you can go and drink another cup. So if you set it up maybe every 1-2 hours, during the daytime, they can drink all the 6 to 8 glasses of water. Is so important. It is during the evening time that we don't want them to drink water. So usually by 7 p.m. maximum, most children go to bed by around 8. So by that time, you can stop them drinking water depending on their bedtime. So at least 1 hour before their bedtime, they should not be taking water. But so if the child is going to if the child is going to go to bed by 8 p.m., you should stop them drinking by 7 p.m. They are going to bed by 7, they should stop drinking by 6, at least 1 hour before their bedtime. But before, during the day, they should drink lots and lots of water. Okay, now before they go to bed, they need to go and empty their bladder. We should remind them, we should make sure that they go and empty the bladder before sleeping. So if there's any urine there, they've empty it as well. Okay, so that will be helpful for the children as well. Sometimes we have to give them rewards for doing the right thing. So when they drink water during the day, we should give them rewards. But please, let's avoid giving them all these juice, all these coffee, soda. Some drinks actually irritates the bladder. Okay, so things like all our soda drinks and all that, they actually irritate the bladder, and juice and scotch, all those things. We need to make sure, if preferably them drink water or weak, if they're going to drink anything like that, maybe weak scotch and all that, and so that they don't actually get the bladder irritated. Things like tea, like cocoa drink and coffee and all those things, they actually irritate children's bladder, and they actually make them to wee, and the chances of pass. So this is not nighttime. You should be giving them like cocoa drink or cocoa beverages or coffee and all those things. We should avoid them as nighttime. They should, if they want to take those kind of things, maybe in the daytime, and not so much. The less of those they take, the better for them. Water is actually preferable. So these are basic things we can do normally for all our children to promote good bowel habits and good bladder habits. But more importantly, for children who are bedwetting, this will be very, very helpful for them. So these are the things we can do as general principles, to help the children um, to get into a good habit. Now, if you are doing all the good things, you're drinking a lot of water, they're not constipated, and they are not taking all the drink in the night, and they are not taking all those irritating drinks that irritate the bladder, but the children are still bedwetting, then what else can we do? All right, so we not have to go into what we call like teaching them routines. Yeah, the routines will help them as well. For example, we said don't give any drinks at least 1 hour before bedtime. Okay, that's number one. Two, let them go to bed before they sleep. Okay, let them go to bed. Let them go to toilet to wee before they sleep as well. So that will help them to uh, you know that will help them to empty their bladder as well. All right. So also let's make sure that the bedroom is close to the bedroom. In fact, sometimes you may have to put the potty in their room. So because some children, they are scared of the nights of walking down to the toilet and all that. So some of them would not want to get up because of that. So sometimes you just have to make it easier for them so that when they feel like going to the toilet, they can, get up. So there should be lights in the. It doesn't have to be very bright, like maybe nighttime lights, but there should be lights in the corridor or the toilet so that it will be easier for them to to go to the toilet. Sometimes we have to help them in the first few time that when they wake up, we just have to be there to help them go into the toilets and do their wee. And sometimes we just have to reward them as well. So you tell them any dry nights, we can have a star chart, and I tell them if you get a dry night, you get a star. Then maybe if you get like 7 stars in a row, then we can have a little bit of reward. It doesn't have to be something big. It can be maybe having extra time on the laptop or the device, or maybe going to a favorite place they like, something simple but something achievable. And so we can use all those basic things to help the children. So sometimes that may help some children and then they will get out of it. However, some children, that is not helpful for them. And despite all that, you've given them water, no constipation, you put in a routine, and you're doing all that, they are still struggling with bedwetting. Then that's the time we have to get the doctors involved. So it's become something that the doctors need to treat, and we have treatment options for bedwetting. Okay, we have what we call the bedwetting alarms. Okay, so some children, especially because when you see the doctors, we will ask a lot of questions. We're trying to understand why is the child bedwetting. We will ask questions about. We may even ask you to do a diary, like how when does the child tend to wet the bed, and is it a lot of urine, or is it small urine? Then during the daytime, did they make a lot of so there are so many things the doctor will ask, and we document that will help us to know what is the likely area where this child bedwetting is coming from. So, for example, if it's just that the child doesn't tend to wake up, the child is a it's a deep sleeper, then we know that so alarm will not work for those kind of children. Or some children, they make so much urine and they themselves will wake up after they made those urine. So we know that their problem is not that they don't want to wake up, but they are making a lot of urine, and even by the time they say 1 hour, they're already wetting the bed, and they may even wet the bed again before the following morning, twice a night. So we know there's still lots of urine. So that helps us to know the best options for treating the child. So we have option of wetting alarms. So some children, it's because they just need to be reminded to wake up. So bedwetting alarms are available. They are, since parents can buy. If you set it up, the idea is that immediately the child starts to make urine, then that urine make contact with the sensor of the alarm, then it will ring, and then those children will kind of jot them out of sleep, and then they can get up, and then they can go to wee by themselves. The one thing with the bedwetting alarm is that you have to use it regularly, you have to be consistent, and you sometimes you have to go up to like 3 weeks and beyond before you can even say it's working or it's not working. And it helps for some children, and it is readily available, and it doesn't have medication side effects and all that, so it's a good thing. But some children, alarm does not work for them. Some children, we have to give them medication. So we have to, especially for children that make so much urine, because like I said, the hormone is not enough to reduce the amount of urine. They are producing so much urine, and so for those one, we have what we call a form of that hormone, desmopressin, and we can give it to the children. And actually, it's available in tablets. It's also available in what the children can just lick. So those ones, we can treat them with those medications as well. So those are the things that we can use to treat the children. And sometimes for the medication, we have to sometimes use this for like up to 3 months. And after 3 months, then we'll check again. And of course, like I said, all this period, you'll be keeping a diary, or, whether the child is dry or not, and then we can see if the child is becoming dry, then we can stop the medication. And some of them, that is it. For some children, it may not work, and we still have to give them the medication all over again. Some children, we have to do a mix of all the treatment. We do the bedwetting alarms, we do the medication, but all of them, even no matter whether we're doing medication, bedwetting alarms, all those other strategies I mentioned about maintaining good bowel habits and all that, and good bladder habits, we still have to always apply those principles to all the time, no matter what else we do. But one thing I want us to remember, what we should not do is punish the child. Okay, some of us, we punish the children, we tell them, we are verbally abusive to them, and sometimes some parents actually spank their children for bedwetting. And I just want you to realize that bedwetting is also like a medical condition, so it is not the children's fault. So please, let's not punish them. Let's not shout on them and all those other things. We can just try and encourage them. Positive method will help. So using the star charts and giving rewards when they do well and encourage them to do better, that also helps them. But we should avoid the negative thing. We should avoid the embarrassing the children and all that. Again, remember what I said about drinks that we should not give our children. Drinks that contains caffeine, okay? All our cola, the soda, the tea, the coffee, we should avoid them, because those ones actually make them to wet the bed the more. Okay, another thing that parents also tend to do is to wake up the children in the middle of the night frequently. We wake them up, we want them to always wake up. So, number one, this method is not always helpful, and it also disrupts the child's sleep, and it just makes the children want to sleep well. Sometimes we also carry them, so we should avoid doing that. Okay, we should just encourage them. So, but like I said, if you have done what you think you can do and that is not helpful, please seek the input of the doctors. Let them now take it up from your hand. But the most important thing for us to do, to make sure we are implementing all those regular hygiene, bladder and bowel hygiene, and all those other methods that we talk about. If you do that, that will be very helpful. So that's talking about bedwetting. But I'm just going to now take a few questions and frequently asked questions that parents ask about bedwetting, and then we can provide a few answers. I mean, sure, some of them may be questions that you have in your mind as well. So the first question is about a 7-year-old daughter who is wetting every night, and she gets upset if parents stops her from wearing pull-ups. So some parents, because their children are always wet in the bed, so they tend to make them wear nappies or what we call pull-ups and all those things as well. And but obviously some children, the children want to wear those things. Some children actually get used to wearing their pull-ups and nappies at night, and they don't want to stop because they don't want to wet the bed. So what do we do in that instance? That's a question that this mom is asking. So number one, as we said, we have to be positive with the children. We have to first always let the children know that bedwetting is not their fault, and we know that even up to certain age, even one in 10, maybe 10% of children at that age will still bedwet. And it means that it's not only the child that is doing it. So we need to get the child buying into it. We need to let them see that, okay, it's a joint effort for all of us to do it, okay? And we can, for children like that, we can encourage them. Maybe one week they use the pull-ups and another week they don't use the pull-ups. So for them, we can put the all these sheets that you put on bed that's I'm trying to remember the name now. Something that you can put on the bed, and the children will not it will not penetrate into the bed. So you can put those kind of Macintosh chairs on top of the bed, and it will help the child. Okay, remember again how we've talked about trying to make, get the child into the star charts or all those reward system, and try and also let them understand if you do it right nice and these rewards and all that. Sometimes those really help the children. And so when you are stopping certain things, you have to do it gradually, and also take off the pull-ups or the nappies. Don't go back to them. So it's better not to be going back to them, again. So because if the child is used to using the pull-ups and the nappies, then they are not motivated to actually want to stay dry. And so, but we have to do it in a positive way, and that will help them. All right. Okay. Next question say my son never wakes up when he wets the bed. Okay, this is another issue. So there's some children that when they sleep and they wet the bed, they actually wakes up, and they themselves will even be the ones to go and quickly change their bed sheets and everything, and that's a good sign. But there are some children that will not even wake up at all, even when they have bedwetted. And so the question is, what do you do in such a situation? All right. So it is okay. Some children are very deep sleepers, and they may not wake up. So the deep sleepers are the ones that tends to do that. So they are so deeply asleep that they don't tend to wake up, and that is just something that happens to them. Sometimes bedwetting alarms could help such children, because it helps the bedwetting alarm just help them to, because it can be vibration as well. It can also be very loud, and sometimes some of the children wake up, and then it gives them to regulate themselves into waking up and going to bed. Going to use a bedroom once the alarm goes off. So it may be helpful. But sometimes for some children, we just have to wait until their brain itself matures enough to be able to help them to go to the bedroom by themselves. And just again, encouragement, positive rewards may be helpful. Then another question say, how long should it take for bedwetting alarm to work? All right, so it takes time. For just like any other thing, if you're using bedwetting alarms, don't expect it to go to start working from after 2 days or 3 days. It takes time. So number one, the children have to get used to the sound, and they have to get used to responding to it. So let's be very realistic. So we should just give them time. So sometimes you have to, most new habits will take at least 21 days, okay? So, but after you've done it for 14 days and the child is waking up consistently 14 days and dry, then we can begin to say, okay, let's stop using the alarms and see whether it will work. And if you keep using it and it's not working after 3 months, then you may want to stop and you may want to try another method. All right, so that is something we can do about alarms. Somebody is asking, is it true that bedwetting is caused by psychological issues? No, like I said, bedwetting is actually a medical issue. It could be due to the bladder, not expanding enough and accommodating enough urine before spilling over, or it could be due to the hormone that is not produced enough in the brain, or a child who is really deep sleeper who are not easily aroused as well. But also we know that sometimes when children go through certain emotional or stressful or traumatic situation, they actually may struggle with one of the signs may be the fact that they will regress and start doing things like bedwetting again. Some even will pull on their body and all that. That is usually what we call secondary and because the child is already been dry, and then all of a sudden the child is now doing those things again. So usually what we normally do is to ask questions, what anything changed, anything happened and all that, and we try to address those issues, and hopefully most of the children can go back to being dry again. So yes, sometimes when children have gone through emotional traumatic situation, they can go back to start wetting again, despite the fact that they've been dry. Okay, but all we need to do is to sort it out and also make sure. So this can also happen for children who deal with what we call secondary emergencies, like if they have infection, if they have constipation, if they have any other health issues. So it's not only like psychological issues alone, it could be any other health issues that can also cause them to start bedwetting again. So all we need to do is to investigate and address those issues, and hopefully most of it will resolve. Okay, another question is, my daughter is 5 and really keen to be dry at night, but we have to wait until she's 7 before going to the bedwetting clinic. No, okay, actually for children, once they are 5 years old and they are still bedwetting, they can be referred to the doctors. You don't have to wait until they are 7 or until they are 10. Once they are above 5, that is when we as doctors will begin to intervene. Somebody else is asking, if I wake up my son a couple of times a night to take him to the toilet, but the child will still wet the bed. So should I stop doing it? Again, like we said, most parents tend to wake up their children several times during the night to go and wet the bed, to go and use the toilet. And this sometimes is not really helpful for the children, and so we usually don't encourage that. We don't encourage you waking up the children several times during the night. It disturbs their sleep and may not be helpful for them. So for such children, we must use other methods to help them, and that may be more relevant than just frequent waking them up. Okay. Somebody say, I find it difficult to encourage my teenage son to care about his wetting. He have found wet sheets hidden in his room, and he acts like there's no problem. Yeah, this is actually very common. It's common for some children, the older children especially, to kind of hide away their bedwetting, and especially it's happened sometimes when we are also being, we have embarrassed them and we have used other negative approach towards the bedwetting. So we need to make the children know that we're on their side and we are together working with them to find a solution. We can help them to keep their own charts by themselves. The days you are dry, the day you're wet. The story was also maybe helpful for such children as well. And of course, at that age, you should get them medical support as well, because there may be other things that is involved for such children. Okay, I'll take another question and then we'll round it up. Somebody said, my 8-year-old daughter has additional needs, okay, and it's still wet at night. Will I ever able to get her out of nighttime nappies? Now, this is a very important question, because children who also have developmental or neurodevelopmental disorders, they also tend to have bedwetting. and most of the time we look at those children by their chronological age, but in terms of realistically, we should be looking at their developmental age. So even though a child is looking at 8 years old, but developmentally that child may not be 4 years old or maybe 5 years old. So, and we know that developmentally is around the age of 5 that we begin to worry about bedwetting. So it's important for us to know that, so we don't judge children with special needs like other children. Of course, it doesn't mean we should not make effort to train them and to support them, but we should focus on helping them understand realistically when they are able to actually developmentally achieve that particular milestones. Of course, most of those children are actually seeing professionals already for their other needs, so we may just want to raise it as well with them. Again, structure, routine sometimes help such children. Once they get into the routine of going to the toilet, regular times, we must encourage our children to use the toilets regularly during the daytime, and at least 7 times during the day, and couple with the fact that they're drinking a lot of water during the day. But once it gets to night time, 1 hour before bedtime, no water, no drinks, and then we can make sure that before they sleep, they empty their bowel and their bladder as well. So once they're able to do that, with time, they will get into that routine, and then they will be able to understand it better. All right, so today we've been talking about bedwetting. For those who are just joining us, bedwetting is a very common problem, and parents tend to see it as a weakness, and sometimes we tend to embarrass our children. So today we've been able to address the fact that bedwetting is actually a medical issue. It's something that can be treated. So I'm just going to give us the take-home messages. Number one, bedwetting, we start talking about it from the age of 5 years. So if your child is not yet 5, don't start bothering about bedwetting. So just give the child time to mature. Of course, you can start implementing the good bowel and bladder habits. So, but we will not worry about bedwetting until after the age of 5. 2, let's promote the good bowel and bladder habits. So number 1, let's ensure the children are not constipated. They eat a lot of fruits and veggies, things that will not get them constipated. And of course, they drink a lot of water. We said 6 to 8 glasses of water during the daytime, and with 1 hour before bedtime, we expect them to stop drinking. All right, before they go to bed, encourage them to do what, to empty their bladder as well. Also during the daytime, let's encourage them to go regularly to empty their bladder. Once they feel it, they should not be holding it to the last minute and all that. Of course, if you notice any other issues like urgency, rushing to go and wee-wee, or weeing too frequently, more than 7 times in a day, please, you need to see a pediatrician, because there may be other causes of that frequent frequency or urgency, and that needs to be sorted out, including constipation, including things like infections, urinary tract infections, including things like diabetes and all that. All those need to be sorted out. So those are the things we can do to, and of course we should avoid drinks that irritate children's bladder, the cola, the soda drinks, the coffee, all those caffeine containing drinks. We should avoid them because they also tend to irritate the children's bladder, and that can also make them to bedwet at night. So those are the things we can do to promote healthy bladder as parents. And sometimes for some children, just doing some of these simple and basic things, that would be the solution. All right, so but if all those are not effective, we can also do positive rewards. We can tell the children, if you are dry, if you drink your water, all the 6 glasses, we can send reminders in our phone. There are apps that can help you to remember, to remind the child to drink water, to use the toilet and all that. So we can work together with the child. We can give rewards, like we can use star charts, and when they can mark it by themselves, we put it in their room, they mark it, and when we agree together on what are the rewards. It doesn't have to be something too fanciful or big, something simple, like 30 minutes extra on the television or on the device, or things, basic things like that. Or we can set up that, and that sometimes motivates some children. Just that motivation will help them, and that will be helpful. Sometimes we can actually try the bedwetting alarms at home. That is something parents can actually do, because it's something you can buy on Amazon or any of those other shops online, and you can use them. And remember that you have to use them consistently, and then some of them are effective, and after 2 weeks of using them and the child is dry, of course, we can stop using it, and hopefully that will be all. But if you try all these healthy habits, you've tried the bedwetting alarms and the child is still bedwetting, you have to see a pediatrician. Please don't assume the child is just going to outgrow it, okay? You have to get help. Let's not waste. The earlier we get the help, is better. Number one, we don't want children to be we don't want their self-esteem to be undermined. We don't want them to be to have low self-confidence because of the shame and the stigma. We don't want them to be scared of going for camps and sleepovers and things like that. So we want to help them, and so that's why it's important that you take the children to see pediatricians. In most countries, most general pediatricians, even GPs, sometimes can treat bedwetting, but sometimes in some countries, I think for example in Nigeria, you may want to see the pediatric nephrologist. Just find out who are the doctors who knows how to manage bedwetting in your locale, and then you can get support for the children. And so, of course, some children, no matter what you do, it may still take some time, but we just need to keep encouraging them, and usually as part of the doctor's evaluation, if they think there are other issues going on with the child, like problem with the urinary tract, the kidneys, or the urinary pathway and all that, of course they will refer you to the urologist and other specialists that can do more complex stuff, but they will know how to do that. But majority of children don't have those complex stuff. Majority of children just have the regular nighttime, only nighttime bedwetting, and that's it. And those strategies we've talked about on this program today, they are the strategies you can use for such children. Thank you so much for listening. So if you still have any questions about bedwetting, please feel free to send it to us. You can either email me at Dr Gbemisola at askthepediatricians.com, or you can head over to our Ask the Pediatricians Facebook group. You can post your question in our group. The good thing with posting in our group is that you can actually post your question anonymously. Nobody needs to know who you are. So you can post and you can ask your questions. We actually have a write-up by a pediatric nephrologist also on our website at www.askthepediatricians.com. So you are free to post your you're free to go over to our website and read more. And there are also all sorts of good websites like Eric and other website that talks about bedwetting, and which you can find a lot of resources and tips for parents. There are a lot of them online. I encourage you to read more about them. All right, so thank you so much for listening to us. And again, this program has been brought to you courtesy of Ask the Pediatricians Foundation. We are very committed to the health and the well-being of our children. So till I come your way, same time next week, where we'll be talking about another important topic that has to do with the health of our children. Stay safe, stay blessed, and have a wonderful day. Thank you for listening, and it is bye from me. Bye.